Now, every vulnerable person in care should have a legal right to a care supporter, such as a relative or a friend, who's allowed to visit them without any restrictions. That's what a group of cross-party MPs, peers, campaigners and families think ought to happen, and they want the government to enshrine it in law because of fears that loneliness, isolation, neglect are a bigger risk now than COVID itself. On this programme, we've heard heartbreaking stories about families who've not been allowed to visit relatives in care homes, even those who are dying. Well, since March last year, one visitor can be designated as an essential caregiver for a family member or a friend in a home. They should be able to come and go like any member of the staff. John is an essential caregiver for his wife Leslie, who has Alzheimer's and has been in a nursing home for 7.5 years, and he's with us. John, government guidance says you should be able to visit Leslie at any time of day, even during an outbreak. Has that been your experience?
No, hello there, Peter. Thanks for inviting me. No, it hasn't. Things have changed and they are getting much better than they were. I still have to make an appointment as to when I'm going to arrive in the care home. Up until this week, in fact, I did have a timed visit. I had to say what time I was going to arrive and what time I was going to leave. And only so many essential caregivers were going to be allowed in the home at any one time. So I couldn't overstay my welcome, so to speak.
And there have been times, haven't there, when you've not been able to visit at all?
Oh yes, in the first year or so, or few months, I wasn't able to go and see my wife whatsoever. The home was closed. They then started having meetings outside, 2 metres apart, and then in a pod indoors with a screen in between. And now for somebody that's got no cognition whatsoever and doesn't speak, they're of no use whatsoever in my view.
Can you tell me?
Sorry.
No, go on.
I was going to say there was one situation in particular when we were in total lockdown that end-of-life visits were the only thing that could be permitted. Now, I did have a phone call from the home saying my wife wasn't eating and drinking, and so I'm not taking medication for a while. So they called me and the family in to see her, which was obviously quite distressing and was a real low point in the proceedings. But after 2 or 3 days of me going in and the family going in, she improved somewhat and started eating and drinking again. At which point she wasn't then considered end of life, and I was stopped from going in to see her again, which I thought was really traumatic and not within the sort of spirit of the rules, really.
And when you challenged the home about that, what reasons have they given you for not sticking to the government's guidance?
Well, but the problem is really, Peter, that the homes have their own guidance in many cases. They don't always follow the government guidance to the letter of the law. So they have their own guidance. And I mean, it's difficult to define what is end of life. I mean, my wife's had dementia nearly 10 years now, so maybe she's been at end of life for all of that time, right. But she's still going. So I don't know for sure, but I would have thought if she was at the end of life one day and to suddenly start eating and drinking, she's not at the end of her life.
No.
I don't understand it.
John, thank you very much for joining us. Helen Wildbore is director of the Residents and Relatives Association. She was involved in organising an event in Parliament this week to call on the government for a new right for a care supporter. And Nadra Ahmed is executive chair of the National Care Association. They represent small and medium-sized care providers. Helen, you've been campaigning, as we've said, throughout the pandemic for better visiting rights for people with relatives in care homes. What's concerning you most about this?
Thanks, Peter. Well, our call really attempts to deal with what is a very long-standing problem, which actually predates the pandemic, when our helpline would hear from people who have been banned from seeing their relative in care, often because they've raised concerns or complaints. And as you said, the last 2 years have really shown the devastating impact on people in care, losing those support networks, not just on mental health, but also on physical health, putting lives at risk. So we're calling for anyone who needs care and support to have a legal right to what we've called a care supporter. That's a relative or friend to support them when they need it, wherever they need it.
So you don't
just in
think
care
that
homes.
guidance is enough, basically?
Well, we must learn the lessons from the last 2 years and say never again. And we know that guidance isn't enough. So we still hear from people, even today on our helpline, who are unable to get visits at the end of life, as John has said, right until the very end of life. We know that people are still battling to get essential caregiver status. And the restrictive definition of an outbreak means that homes have been in rolling lockdowns and residents isolating for many months. And providers have been pleading with the department as well as us for change, but there's still no action on that.
Let me bring in Nadra Ahmed. I mean, it is alarming to hear that some people have stopped eating and drinking because they feel abandoned by relatives. Surely, this does highlight an urgent need for a care supporter who's a family member, doesn't it?
Well, absolutely. I mean, I think these are really challenging times. We're talking about the COVID period especially. I mean, pre-COVID, obviously, care providers did open their doors to everybody, and we had people coming in at different times of the day. There were no restrictions as such, and they may have been cases where there were challenges, but certainly the vast majority, and I'm talking about the vast majority, we had open services. What we found in COVID is that, in the initial stages, care homes were absolutely not included in any thinking, either at government level or at local level, and we were done unto. So there was guidance put out that was very strict. And it was the provider sector that was fighting for the essential caregivers. We're the ones who were saying that, we can see the impact on the well-being of the residents. And also it was quite challenging for our staff because it was a very difficult time. And staff were they can never replace family. We can never replace family and friends, but they were having to make different attempts at trying to keep people motivated.
OK, Nadra, I've got to stop you there because we did want to get the government view on this. We asked the Care Minister, Gillian Keegan, to come on the programme. She didn't want to, but she told us there are now no limits on visitor numbers to care homes, and during a COVID outbreak, essential caregivers should still have access. Helen, how much does that reassure you?
Well, Gillian Keegan, the Care Minister, did attend our event on Wednesday in Parliament, but unfortunately she only arrived at the very end, and it was really unfortunate that she didn't attend to hear our speakers, and she would have heard directly from them that what she's just said, I'm afraid, just doesn't reflect the reality of what's happening on the ground.
Helen Wildbore, Nadra Ahmed, thank you both very much indeed. Now, you can't really miss the